Better Housing, Better Health is a healthy home scheme run by the National Energy Foundation in partnership with 11 local authorities across Oxfordshire and Buckinghamshire and Oxfordshire Clinical Commissioning Group. The scheme aims to improve health and well-being and reduce pressure on health services by making homes warmer and healthier places to live through practical energy efficiency improvements and advice.
The project predominantly targets people who have existing health conditions such as cardiovascular disease, so people who've had heart attacks, people who may have heart failure, who may have had a stroke, and also people with various respiratory conditions, because we know that cold homes can sometimes be damp homes and that can affect people's lungs.
155 referrals have been made to the scheme by a range of health and social care professionals, including social workers, GPs, respiratory nurses and occupational therapists. 107 of these referrals have received a grant of up to £2,500 to make their homes warmer and healthier through measures such as new heating systems, insulation, improved ventilation and damp work.
I've got a bit of a dodgy heart, which is okay, we're coping all right with it, but getting cold is one of the things. You do feel the cold an awful lot. Outside insulation we wanted, which is solid. Since that's been done, I mean, it's been 100 times better.
Janet has been a lot better since we've had this done. She suffered with a cold and she has been sat in her chair over there with a fleece and blanket on. It got that bad. The one point of contact was a great help, because you know the person, you get to know the person you're talking to on the end of the phone.
As well as giving positive feedback from the support they've had from Better Housing, Better Health, there seems to have been a reduction in the amount of time they needed to see their GP, the frequency they needed to see their doctor, and their health seems to have had a general improvement.
When a referral is received, a home visit is arranged by the local authority to assess whether the property is likely to be contributing to health conditions and to recommend improvements that could be made to improve health, increase comfort and reduce energy use.
I think that the home visits have made a real difference to the residents, because a lot of the ones I've visited are either elderly or spend a lot of time at home because of their health. So it's been really good for them to be able to talk to someone face to face about the problems that they're having, and then to actually have help with the work getting done has been a real boost for them.
In total, the authorities have been involved in undertaking 118 inspections of clients' homes as a result of health referrals. And we've been able to deliver in total, I think, works amounting to some £220,000 through Better Housing, Better Health directly. But the local authorities have also been able to bring some further funding to top up where that was necessary.
500 people have also been assisted by the scheme's citizens' advice caseworkers to check they're claiming the benefits they're entitled to cut their energy bills and to manage any fuel debt.
So Molly, you remember when I came to see you and BHBH had referred you to us so that we could see whether we could help you to keep warm by looking at your fuel bills, seeing if you could do it any cheaper. Can you tell us how much you saved every month?
I've saved £23 a month.
That's excellent, isn't it? You were struggling a bit from the point of view of your health problems.
Yes.
Yes, and so we decided between us that it was worth applying for attendance allowance.
Yes, that's right.
And you got it.
I didn't think I would qualify for it. I used to get really breathless getting to the bus, and by the time I got to the doctor or the hospital, I couldn't talk. The attendance allowance means I can pay for a taxi now, which I always struggled on the bus before.
Our initial funding from the British Gas Energy Trust is running out, and we can't continue to offer this vital service without additional funding. So if you can help or are interested in working together to proactively address the health impacts of cold homes and fuel poverty, then please contact the National Energy Foundation.